Statistically, the data indicates that about 1 in every 4 people suffer from some kind of diagnosable illness. Well, I think that if stigma is going to be eliminated, it's going to be eliminated by peers who are willing to step up to the plate and share their story.
The peer support that they are giving and providing does a lot for that peer, and not just for the individual who's receiving the care. The peer is providing a service, they have meaningful work, meaningful employment, and there is a lot of benefit that they receive mentally and emotionally from providing care. Kind of turn the tables, and the individual who's in crisis, who's receiving the service, really comes to realize that these conditions can be treated. They can live a meaningful life, they can contribute, they can have relationships.
Peer specialists do the one thing that I think that most people with lived experience have difficulty doing. It's my ability to discern the difference between what is a strength on the part of an individual and what may present challenges for an individual, and to work with that person to, number one, create a plan to deal with those life stressors, while at the same time to have a vision of wellness for themselves so that they can move forward.
Our peer specialists work with families as well as individuals. We're working with chronic mental and physical conditions, the population that's struggling with opioid abuse and use. We're working with substance use. We're working with the developmentally disabled. It's so varied in what we're doing.
There is this sigh of relief that happens when a new caller calls the warm line and finds out that the person that they're talking to is a person who's been there and done that. We have 2 main services that are predominantly provided: recovery education, so anything and everything related to recovery, from wellness and recovery action planning to whole health action management. The other service is emotional support. Emotional support is such a wide, broad scope. It just really means I'm here for you.
It's more than just behavioral health. It's, do they have the food they need to eat? Do they have their medications? Do they have somewhere to live? And do they have the social supports that they need to live a more productive life? When you really look at what we're impacting, where we can really show a difference is if we can connect that member to that discharge appointment. That's where our peers and our clinical staff really work together to make sure that we are wrapping around all of the services we can to support that member in their path to recovery.
One of the things that we're charged with doing is really working collectively with people on the ground to evaluate ways to grow our business. I believe wholeheartedly that by articulating our understanding of the needs of the people we serve, by being authentic in our understanding of their needs, and then crafting very specific programs and support to meet those needs, we grow. So when you think about peer support in particular, it's not a product at Beacon. It's not a product. It is part of who we are and what all of us embrace as it relates to our mission.